Hey everyone, this is Dr. Carl Baird at Evolve Performance Healthcare. Today I just wanted to have an open and honest conversation about what it is going to take to finally solve that low back pain. So again, we speak with people who have been dealing with low back pain pretty much every day. And what we've started to notice is that, again, especially in these initial conversations with people, is that people are just really confused about what they need to be doing. And when you start to think about it, it really starts to make a lot of sense. I mean, they've probably been on the internet, they've been on YouTube saying like, do this exercise and do this exercise. They've been to probably a multitude of providers, chiropractors, physical therapists, acupuncturists, massage therapists, who all tell them different things. And so again, they just end up confused about what to do. So again, what I thought would be important is to just address kind of three kind of things that you really need to focus on or really need to understand if you're serious about finally solving this low back pain. So again, not just kind of living with it for the next years and getting an occasional adjustment here and there, but really what it's going to take to solve it. So the first thing that we need to address is that come to an understanding that for most people, pain is not their actual problem. So again, they'll come in saying, I have back pain, but most people put up with a certain level of back pain and they only go to seek help from a professional, whether that's, again, a chiropractor or physical therapist, when there is a concern or worry about how that pain is going to impact some other aspect of their life. And so why this is important to keep in mind is that a plan to get you out of pain is very different than a plan to get you back to doing the things you love. So a lot of times, I mean, the initial conversations with people, I always ask, hey, what's the goal? And a lot of times their first reaction is, just get me out of back pain. And then I'll say, great, go lay on the couch for a day or two and take some ibuprofen and back pain will go away. But that doesn't get them any closer to being able to run, being able to hike, being able to play with their kids, which are really the concerns that most people have. So it's really important that we understand that a plan to get out of back pain is very different than a plan to get you back to doing the things that you love. And if we just focus on the pain, we're not really going to have that impact on your life that you want. The next one kind of feeds into that, and it's the idea that there's a very big difference between helping somebody live with a problem versus actually solving that problem. So again, I right out of school worked at a traditional chiropractic clinic, and the general pattern is a client would come in, we would adjust them, we would do some soft tissue work, they would leave feeling great, they'd come back in a month with the exact same problem. So can you really say that we were solving the problem if every month they were coming back with that exact same problem? Probably not. And so what's important to understand, especially with non-traumatic back pain in adults, usually starting around over the age of 40, is that a lot of that pain is caused by one of three things. One, we're not moving the way that we should be moving. Two, we're not moving enough. Or three, our bodies aren't as strong as we would like them to be to support the things that we like to do. So if we're talking about creating a plan to solve back pain and getting you back to doing what you love, not only do we have to focus on therapy, but it has to include some sort of movement training and some sort of strength training. And if it's not, then again, it's really just helping you live with the problem. It's not getting to the heart of that actual problem. And the third thing, so go feeding into those two, is that when you're looking for somebody to help you with back pain, it's not necessarily the best doctor, but it is somebody who's going to be a very good coach as well. So again, doctors can be very good coaches. But what you're going to need is for somebody to put a crystal clear plan of exactly what you need to be doing, and coupling that with providing the accountability, the motivation to get you to stay consistent and stay positive so you can reach those goals. So if you are ever thinking about back pain or talking to anybody or waiting for that magic cure, or even worse, maybe a doctor or somebody else is saying they have that magic cure, that quick fix that everybody's looking for, I can tell you right now that they're lying to you, and it's probably not somebody that you should trust to handle your low back pain. It is going to be a team effort with the expert, the coach, the doctor putting the program together for you, and again, providing some therapy to get you some pain relief in the short term. But it does take effort on the patient to actually learn how to move and go through those repetitions and put in the work to build that strength. And if you don't do that, I can guarantee you the pain is always going to come back. So not only do you need a good doctor, but you need that person also to be a very good coach to hold you accountable, to make sure that you're working towards a specific goal. So that's all I got for you today. And again, if you ever had any questions or wanted to work with us, again, the first visit is always on us. So again, that can be a phone call. That can also be a free visit in the clinic here. And if you just wanted some more information, go ahead and click the link below. Again, we're happy to help any way that you can, just to help you make a better decision about what to do about your back pain. So again, thanks again for watching, and we'll talk to you soon.